Dr. Bloch is a GP in a small town in Germany. She always wanted to run her own surgery, independently and in long-lasting personal bonds with her patients. With her surgery, Dr. Bloch forms a vital part of Germany's self-governed health system. Whereas in many other countries, medical care is organized by the state and its own public institutions, in Germany it is the health system itself that organizes medical care, financed by the fees from all members of the public statutory health insurances. In other countries, surgeries and hospitals are financed by the state with tax money. In difficult times, that can quickly affect quality and quantity of medical care. Also typically German, the principle of benefits in kind, which means members of statutory health insurances are entitled to medical treatment, therapy, cure, remedy, drugs and aids without having to pay for any of it, especially not in advance. Here the state limits itself to setting the legal framework and defining the duties within. The actual medical care is shaped by the care providers and their organizations, for instance, independent ambulatory doctors or hospitals. In the case of independently working doctors and psychotherapists, it is the KBV and its 17 regional associations. They negotiate with the statutory health insurances, the portfolio of treatments and according fees. They also take care of settlement between each surgery and health insurance. And they ensure everyone receives ambulatory care, medical and psychological, even on weekends and bank holidays. Dr. Bloch regularly is on emergency duty. Its nationwide service is available 24/7. Her colleague, an eye doctor with his surgery around the corner, takes part too. Like the psychologist next door, he and Dr. Bloch run their own surgeries, freelance and independently. Together, they form a tightly woven net of around 100,000 surgeries. For patients, this means a great variety of choice and short distances. In the name of these surgeries, the KBV negotiates within the Federal Joint Committee, the highest body in self-governance. Here, all relevant organizations come together. Doctors and psychotherapists from ambulatory care as well as dentists, hospitals, public health insurances and patients. Hence, medical care is decided upon by those who provide it. With their surgeries, Dr. Bloch and her colleagues ensure provisioning hospitals for the treatment of critical and serious conditions. An advantage, not least in times of epidemics or pandemics. In order to maintain this provision, doctors like Dr. Bloch and their psychological colleagues campaign for good political conditions, represented by their regional and federal organizations.